Now that we've talked about the parasitic protozoans, we can move on to the parasitic helminths, more commonly known as all the worms that can cause disease. Now, the helminthic parasites are macroscopic, which means they are larger. So then usually I get the question is, well, why do we talk about them in microbiology? Well, they are transmitted via egg. They're usually diagnosed via egg. So they're diagnosed and transmitted microscopically. It's just the adult form is large. They're multicellular eukaryotic worms. They have complex life cycles. They usually have multiple hosts, lots of intermediate hosts that eventually make it to their definitive host. Some of the worms are dioecious, which means there are male worms and female worms. Some are monoecious, which means they've got both and can fertilize themselves. When we have parasitic worm infections, one of the responses our immune system has is that it does increase the number of the very specific antibody E, as well as an increased number of eosinophils, because the eosinophils will actually start to attack those parasitic worms. And I always like, they both have an E in it for your immunoglobulin or antibody E and the eosinophils. Both are at an increase with parasitic worm infections. These are both the same two things that are also increase when you have allergic reactions. So completely unrelated, but both triggers these particular immune system responses. Now there are three groups of helminths. There are cestodes, more commonly known as tapeworms, trematodes, more commonly known as flukes, and nematodes, more commonly known as roundworms. So we're going to start at the top up here with our cestodes or our tapeworms and kind of work our way down. So cestodes are tapeworms. They're flat, like a piece of tape. They're segmented, and they're intestinal parasites. They don't have a digestive system, so there is no mouth, there is no digestive tract, there is no anus. They do have a head region, but they're not feeding from it. They don't have eyes, but it is where they are attaching themselves. So they usually have, the head is kind of what's called the scolex region, and usually have some type of attachment organ such as suckers or hooks, or even on this particular one that's got both. How they get their nutrients is once they attach, they actually acquire the nutrients through their skin. Each of the little segments is the proglottids, and then when the proglottids all start at the scolex, and then they're formed up here, and then as they go down, they grow, and then they mature, and each one of them, each tiny little segment, has both male and female parts, so it's constantly fertilizing itself, constantly laying eggs with every single section. Every tiny little section is laying eggs. Now, a generalized life cycle of a tapeworm, we're going as the pork tapeworm is our generalized one on this diagram, is that we eat undercooked meat, and in that meat is the larva stage of the tapeworm. Once we eat it, releases itself, it grows, and then attaches that scolex head into our intestinal tract. From there, it will start to make those proglottic segments. It will start to feed off of what's in our digestive tract through absorption, and it will constantly lay eggs. Eggs will leave with the fecal matter, and then it starts the whole life cycle over again, as if, say, a farm animal eats contaminated fecal matter that has those eggs in it. Some of the more common tapeworms that do affect humans, not the only ones, Taenia saginata and Taenia soline, commonly known as the beef tapeworm and the pork tapeworm, because their intermediate hosts are cattle and pigs. So eating undercooked beef and undercooked pork puts you at a higher risk of picking up these tapeworms. Those that are at the highest risk are the ones that are living with and working with or living close to livestock, and then with that have inadequate sewage treatment. And this is when we get into, our area that usually includes Amish. If they don't have sewer septic systems in their house, they use outhouse inadequate sewage treatment. And if there's any chance that one of their farm animals is going to ingest any of that and get the eggs, and then they eat undercooked meat, it starts that life cycle over and over again. Now, depending on how many tapeworms you have, Can kind of depend on what your symptoms might be. You might be asymptomatic, not even know you have a tapeworm, but you are still shedding those little segments. Chunks of those little proglottids are called strobilus. You're shedding some of them, whether you realize it or not, in your fecal matter, and you are releasing eggs. So it's not uncommon that an adult tapeworm can have anywhere between 1 and 2,000 proglottid segments in it. And each one of those little segments, if it's mature, can produce 100,000 eggs a day. So you're shedding eggs all the time. If you get enough tapeworms in your intestinal tract, it can cause intestinal blockage. Another tapeworm that can affect humans is the Echinococcus granulosus, more commonly known as the canine tapeworm. It is smaller, usually only has 3 proglottids, so it's a lot smaller than, say, the pork or beef tapeworms. Canines or dogs get them from eating herbivores that have that cyst embedded in the muscle. And when I say herbivores, if you've got a dog that catches and eats a squirrel or a rabbit or some other animal in your yard, obviously it's not cooked, they ingest the cyst. Humans are accidental intermediate hosts. We're an intermediate host, which means the worm itself cannot develop into the full adult tapeworm. We can get larvae in the body, but it will not develop into the actual adult tapeworm, which will lay eggs. So we're just considered accidental hosts because the tapeworm would rather not get in us. How we pick it up is contaminated food or water that has eggs from dog fecal matter. The problem is, once we ingest those eggs, they could potentially develop into the larva, get into the circulatory system, and those larvae, wherever they end up, can form a cyst around themselves, waiting to finish the life cycle, pretty much waiting for a dog to eat us for it then to develop into its adult life cycle. That usually doesn't happen, that dogs are eating humans, and so again, accidental hosts. But even though it can't develop into the full adult in us, because it can still form a larva and then form that cyst around the larva, where the cyst ends up can cause a lot of issues. So cysts can end up in eyes, they can end up in the brain, and again, there is a larva in there just waiting to get eaten. It's known as a hydatid disease. It's that you have these cysts with canine tapeworm larvae in them waiting for completion. If they're in your body long enough, they can start to calcify and cause issues. But again, it's just waiting, and we're accidental hosts. Our best way just to prevent it, good hygiene. If you've got a dog that eats random animals because it can catch them, be extra cautious that you're good hygiene after picking up dog poop. Our next group are our trematodes or our flukes. Shape-wise, they look a little bit different. They're flat, they're leaf-shaped, not like maple leaf shaped, but just kind of leaf-shaped. They also lack a complete digestive tract, but have a digestive tract. So they do actually have a mouth and intestines, but there is no anus. So whatever goes in comes out the same opening. They usually have some type of sucker to attach themselves to their host and then obtain their nutrients, because they do have that mouth. Where they parasitize the body is generally how we group them. Now, a lot of flukes are tied to some type of water life cycle, meaning one, if not more, of the life cycles is tied to some type of aquatic vegetation, some type of aquatic organism, such as a snail or a fish or some type of vegetation like watercress. Again, how we pick it up, we eat watercress, we eat fish that isn't cooked, your sushi, or depending on which one it is, some of them can actually burrow through skin if you're in contaminated water. Once they get in the body, they start to develop, they can develop into a definitive host. If we get one of the human flukes in our body, we shed eggs. If you urinate or have fecal matter that ends up in water, starts the whole life cycle all over again. Now, a couple of the trematodes that cause us issues. One is called Fasciola hepatica because it affects the liver. That's the part of the name. The other is Fasciola gigantica because, again, these are very large flukes. They are visible. We don't need a microscope to see them when they're an adult. They're usually found in sheep and cattle, and we again are accidental use of the audio. Another of our trematodes is the schistosoma. These causes the disease known as schistosomiasis. They are dioecious blood flukes. What the dioecious means is in the adult, when they're actually their adult stage, we do have males and females. Now, schistosomiasis is extremely common, again, because we can get them. Part of their life cycle is tied to water, it's tied to snails. Sometimes it's called snail fever, is the schistosomiasis, but extremely common, mostly common in Africa, Asia, and South America. About 170 million people a year are treated for schistosomiasis, and about 200,000 die. So it can be deadly depending on how long you've got that parasite before being diagnosed and treated. Luckily, the snails that carry this particular organism are not found in the United States yet. So it's not spreading here in the U.S., but if you travel or patients have traveled to Africa, Asia, and South America, it puts them at an increased risk for this. Now, there are 3 species of schistosoma that can infect humans. They all cause the same thing, but we are the definitive host at all 3 of these when I get in there. How we can tell the difference between them microscopically as we look at the eggs, each 3 of these look a little different. Their spine, they got a spine on their egg, is found in a different location. This one's kind of found near the back, but not all the way. This one's exactly on the back, and this one actually is more of a curved egg versus football shaped, and its spine is kind of has a hook. So just slightly different from each other. Now, how we can pick them up, a lot of the time it's swimming in infected water. And the intermediate stage that's in that water that was released from a snail burrows in through the skin. Yay! It causes a condition known as dermatitis, which we feel is swimmer's itch. And so we get it anytime we have contact with infected water. We're swimming, bathing, or depending on parts of the country, are they washing clothes? Once it burrows in through the skin, the larvae will mature and then mate in the circulatory system. So they lay their eggs in the blood vessel walls. The eggs eventually can travel to the intestines, they can travel to the bladder, the ureters, and they can get eliminated then via contaminated fecal matter or urine back out into the environment. Depending on how many worms you get into your circulatory system, your blood vessels, how many worms get in your body, how many eggs end up being released and targeting different areas of the body, it can cause irreversible tissue damage and again can be fatal. Best prevention, improved sanitation, the sewage treatment, so that contaminated fecal matter in urine that has these eggs in that doesn't end up in water supplies where then people are swimming. And then our last group of our helminths are our nematodes or our roundworms. So the roundworms, because truly they are cylindrical, they do taper at each end. They do have a complete digestive tract, so they've got 2 openings, both the mouth and an anus. They have a protective outer cuticle to protect them from our immune system, and they are found in almost all vertebrates in the world. Now, there are different life cycles. There are different ways that we can pick up some of these roundworms. So there's intestinal nematodes. The eggs are shed into the lumen of the intestine, and then they are released, and we pick them up by eating contaminated food or water. This would be a fecal oral spread. Some intestinal nematodes, the larvae hatch in the soil, and the larva can actually penetrate or burrow through the skin. Some nematodes insist in muscle tissue of, say, animals, and we get infected when we consume raw or undercooked meat. There's a few filarial nematodes where mosquitoes transmit them, but either way on how they get transmitted, the definitive host is where that adult worm develops and where it continues or it begins to make eggs to continue the entire life cycle. Our first nematode, which is one of the largest of them, is Ascaris lumbricoides. It is found in the United States, more in the rural southeastern area of the United States. It's extremely common. About 1 billion people a year get infected with this. Again, just thinking how many are on the planet, 1 billion a year. It is usually more in tropical, subtropical regions. As an adult, they can be up to 35 centimeters or about 13-14 inches long. So these are very visible. We again pick them up by ingesting eggs in either contaminated water or on vegetables that haven't been washed. Once we ingest the eggs are going to invade the intestinal wall lining, get into the circulatory system, and go to the lungs. From there, they are going to grow and they're going to develop into large larvae. Once they've grown in the lungs for about 2 weeks, they are now too big to burrow back through the lung tissue, and they need to end up back into the intestinal tract. And so the way they go from lungs to digestive tract is that we have to cough them up and then swallow them back down. So if you're coughing and you feel a little something that came up, if you're swallowing it back down, it might have been a larva. Once it's in the intestinal tract, now it will then develop into that full adult worm where it can get to be that 13-14 inches. Depending on how many you have, can depend on your symptoms. You might be asymptomatic. You might have a worm right now. If you get enough of them, it can cause abdominal pain, nausea, diarrhea, vomiting, and even intestinal obstruction. If there's enough of them, it can be fatal. It can cause damage to the intestinal tract permanently. It can even cause anemia if it causes damage where it's now bleeding. Best way to prevent it: proper sanitation, good hygiene, making sure you're washing vegetables, making sure you're not drinking water that might be contaminated with these eggs. Another group of nematodes, these are hookworms. Now there are a lot of hookworm species out there. There are 2 that infect humans. So we don't care about all the other ones that infect all the other animals and other things out there. The 2 that infect humans are Encyclostoma duodenale, infects the duodenum, the small intestine, and Necator americanus, because it is predominantly found here in North America. Now, hookworms, when eggs are released, they will hatch into larvae in soil. How we pick them up is the worms can burrow through our skin. They will travel to the heart and lungs. They will hang out there and develop. Again, to get to the small intestine, we have to cough them up and swallow them back down. And then once they get to the small intestine, they can live there for 1 to 2 years and sometimes even longer. Once they get into the intestines, they use their mouth with their jagged teeth to attach themselves to the small intestine and suck blood. So they cause anemia. And even though they only suck about 3 drops of blood a day, there's never just one hookworm. You may have hundreds of hookworms all drinking 3 drops of blood a day. That adds up to a lot. Now, an initial symptom that you may have been infected is because they do have to burrow through your skin, is that you get super itchy, very irritated and inflamed skin on your feet where they were burrowing in. That's your first indication you should be heading to the doctor's office to get tested and treated right away. Luckily for us, and to diagnose, they will look for eggs and fecal matter. We do have lots of treatments to kill them, but your best bet is just to not get them in the first place. Wear shoes. Now, again, you pick it up by walking around barefoot in soil where eggs possibly could have been laid that came from an intestinal tract, whether it was human intestinal tract or animal intestinal tract. So walking on a beach barefoot puts you at an increased risk. If you are on a farm walking barefoot, that puts you at an increased risk because of animals that are walking around and defecating. So just wear shoes. The next of our nematodes is Enterobius vermicularis. It's a pinworm, so it's very skinny, very tiny, and thin, like a pin. It is the most common in the United States. There's about 40 million cases in the United States a year. Humans are the only host, so it is spread fecal-oral, and it's a human fecal-oral, so it's human to human fecal-oral. Now, this is one of those that I swear when I talk about things, either they show up in my news feeds or my kids get them. And it was one semester that I swear it was 2 weeks after I talked and had this lecture, my kid got this. How I knew. So, the pinworm. The female pinworm is the one, because they have male and female, lays eggs. But it doesn't lay eggs in the digestive tract. Instead, it comes out of the digestive tract at the anal opening just at night, lays the eggs, and then goes back in. Again, this continues and promotes the life cycle, because how it's then picked up, it causes intense perianal itching at night, which then, as you are itching back there, you get it on your hands, your fingers, you don't wash them, and then you eat something, it goes in your mouth, and you complete the life cycle and continue it going on and on and on. So, at bedtime, this was years ago now, when my kids were a lot smaller and they were in daycare, and daycares are dirty. Yes, lots of itching back there, only at night, so I knew what was going on. Again, 40 million cases in the U.S. every year. Super common. It's common enough that you can get over-the-counter medicine for it from Amazon. So overnight delivery was great. Now, how they determine that it's this particular parasite, what they will send you home with if you take your kid to the doctor, they'll send you home with this. It's it almost looks like a test tube, but then it has this little paddle on the inside, and it's sticky, and they're going to ask you at night to stick this right at the anal opening, hoping to capture some of the eggs. Underneath the microscope, they can see these eggs. They look like little clear footballs. You yourself could do this as well. Packing tape and a, cheap little kid microscope you could identify as well. This is a light microscope. It's not an electron microscope. These are visible with an at-home kid microscope set. And then you can diagnose and treat. Best prevention is good hygiene, is making sure your hands are washed all the time, that you're not ingesting eggs, you're not doing that fecal oral. And then because it causes that itching, and because you can keep recontaminating yourself with more and more eggs every time you itch, is if there is an infection, making sure that bedding gets washed every day to try to remove any eggs so that reinfection doesn't take place. Another nematode that spreads specifically by mosquitoes is Wuchereria bancrofti. It's a filarial nematode, and it likes to live in the lymphatic system and cause damage to the lymphatic system. It's spread by several different mosquitoes, several different mosquito species, luckily none found here in Wisconsin. They all seem to be found more in tropical regions. Once that mosquito bites you and this egg gets into the bloodstream, it travels to the lymphatic system, it develops into an adult worm, and for years you wouldn't even know that you have this worm. in your lymphatic system. But as you get older and as it causes more damage, it causes damage to the lymphatic vessels. And the lymphatic vessels transmits fluid around the body. And if we can't move that fluid throughout the body, through the lymphatic vessels, it all pools down into your lower extremities, leading to a condition known as elephantiasis. And again, the lymphatic vessels are completely damaged. It's a permanent damage, and all that lymph that should be going up through the body now pools down into those lower extremities. Now, it can live in your lymphatic system for easily up to 20 years, again, causing damage. But it stays in the lymphatic system during the day. But because wherever a lymphatic vessel is, there's a circulatory vessel, a blood vessel. At night, usually at dusk, these worms will travel from the lymphatic vessels into the blood vessels. And then as day comes around again, they go back to the lymphatic vessels. This again is causing a lot of damage. Reason why they travel from a lymphatic vessel to a circulatory or a blood vessel at night, that's when the mosquitoes are out. This is when they want to get sucked up by a mosquito to complete and keep getting that life cycle to continue through. So the best way to avoid getting it is avoid infected mosquitoes. So if you know you're going to travel somewhere that's endemic to this particular organism, make sure you've got all the proper bug spray so that you don't get infected with mosquitoes. We do have treatment, but a lot of times it goes undiagnosed for a long time, and by the time you start to get to this, there isn't anything you can do. The damage to the lymphatic vessels is already done. And so we're going to end right there with our last of our nematodes. So, if you didn't think all those bacteria and viruses and fungi and protozoans were enough, now you're going to be worried about all these awesome big parasitic worms too.